Okay, so thank you for coming to today's session. Firstly, I'll be seeking your consent for 4 things: pre-participation screening, balance assessment, cardiovascular assessment, and your exercise prescription. So we begin with the pre-participation screening. Don't worry, it's a guided questionnaire. Basically, it's a health questionnaire which is done to identify individuals who should receive medical clearance before starting exercise or increasing volume or intensity training, or individuals with clinically significant diseases who require medically supervised exercise programs, or individuals with medical conditions requiring exclusion from exercise programs until their conditions get better. It's very important to do this as we cannot allow clients to start exercise without going through this pre-participation screening. And if the client needs medical clearance, we cannot allow clients to start exercise as well. We also cannot allow clients to exercise at intensities higher than what they are cleared for. So if you have cleared this pre-participation screening, you can move on to the balance assessments and the cardiovascular assessments, and then the exercise prescriptions. So the reason why you have to perform these assessments is so that I can develop a more tailored exercise prescription plan for you instead of a cookie cutter plan, so that they can fit your specific training goals and ultimately help you achieve them. So on the day of the assessment, I will once again seek your consent and guide you through the procedures, instructions, safety precautions, and the indications for terminating the assessment. Before the assessment, I will also be measuring your heart rate and your blood pressure. So during the balance assessments, I will have to perform spotting, which is where basically I'm just supporting you, where I'm standing near you to catch you in case you fall so that you don't get injured. So after the assessments, I will analyze the results, and based on them, I will prescribe you some exercises to do, and I will provide you with alternative exercises that you can do. With that being said, as my client, you must fully understand and be aware of that number one, you are volunteering to participate. You are responsible in informing us of any problems that you may be experiencing. You are free to withdraw from participation at any time with no consequences. You are allowed a Q&A session with me. You should know that the benefit of this assessment is that I'm able to properly assess your fitness and to provide a detailed exercise prescription for your cardiovascular endurance and your balance and all that. You should also know that the risk involved for this assessment includes fatigue, muscle soreness, irregular heartbeat, chest pain, or even sudden heart attack, but we have measures put in place to avoid risk of these. You should also know that there are alternative assessments, and so if I have your full informed consent, can you please sign this form? Okay. Thank you. Do you have any questions before we begin with the ACSM pre-participation screening?
No, sir.
So I'll begin with the ACSM pre-participation screening now. Do you have any chest discomfort with exertion?
No.
Do you have any unreasonable breathlessness?
No.
Any dizziness, fainting, or blackouts?
No.
Any ankle swelling?
No.
Hold up. Any unpleasant
No.
awareness of a forceful, rapid, or irregular heart rate?
No.
Any burning or cramping sensation in your lower legs when walking short distance?
No.
Okay. So moving on to the next step. Have you performed any planned structured physical activity for at least 30 minutes at moderate intensity on at least 3 days per week for at least the last 3 months?
Yes.
Okay. So next, have you had a heart attack before?
No.
Have you had heart surgery, cardiac catheterization, or any coronary angioplasty?
No.
Do you have a pacemaker, implantable cardiac defibrillator, or rhythm disturbance?
No.
Do you have a heart valve disease?
No.
Do you have heart failure?
No.
Have you had a heart transplantation?
No.
Have you had congenital heart disease?
No.
Have you had diabetes or have diabetes?
No.
Do you have or had renal disease?
No.
Okay, so moving on to step 4, what is your desired exercise intensity?
Vigorous.
Okay, so based on these results, you are cleared to continue current exercise or volume intensity or progress as deemed appropriate. So the way I determine your outcome is through these 2 charts. So since you regularly perform planned structured physical activity for at least 30 minutes at a moderate intensity for at least 3 days a week for the last 3 months, I can use this chart, which is for clients who exercise regularly. So as you can see, you have all of these, hence you do require medical clearance, and you can continue current exercise volume/intensity or progress as appropriate. Okay, so for the pre-test considerations, you need to abstain from the following prior to the fitness assessments. So number one, no exercise on the test day, ensure ample rest, no alcohol within 3 hours of testing, no caffeine, food or tobacco within 3 hours of testing. Your attire should allow freedom of movement, so no jeans, wear walking or running shoes, so no Converse shoes. You should also drink ample fluids over the 24-hour period preceding to the exercise test to ensure normal hydration before testing. Some medications affect your resting heart rate or exercise heart rate. If exercise test is for diagnostic purposes, you are advised to discontinue prescribed cardiovascular medications but only with your physician's approval. If you are taking intermediate or high dose beta blocking agents, you may be asked to taper your medication over a 2 to 4 day period to minimize hyperandrogenic withdrawal responses. If the exercise test is for functional or exercise rehab purposes, you should continue the medication regimens so that the exercise responses will be consistent with the responses expected during exercise training. You're also required to bring a medications list, including dosage and frequency, to the assessment and should report the last actual dose taken. As an alternative, you may also wish to bring your medications with you for the exercising staff to record. So for safety, you may want to have someone to drive you home afterwards as you may be quite fatigued.